Good morning. My name is Stephen Wu. I'm from Camas High School in Camas, Washington. I play piano and I plan on going into engineering or immunology in the future. Today, I'll be presenting to you the antimicrobial crisis the world faces today. Thomas Frieden, the former director of the United States Centers for Disease Control and Prevention, in 2013 said the following: "We estimate about half of all the antibiotics used among people in the United States are either unnecessary or inappropriate. We are taking this precious resource and squandering it." I would like to provide everyone with a brief history of antibiotics and how they were discovered and first used. In 1928, Alexander Fleming discovers penicillin in England. He discovered that a mold that was later identified as penicillin inhibited the growth of the Staphylococcus bacteria. In 1939, a study done by Howard Florey and Ernest Chain found that mice infected with deadly viral streptococci bacteria died when left untreated, but survived when injected with penicillin. Penicillin was later manufactured by American pharmaceutical companies such as Merck and Pfizer. After entering World War II, the United States government became interested in penicillin use because penicillin could treat infections from wounds, which was previously a major cause of death on the battlefield. In 1945, Florey, Chain, and Fleming all shared the Nobel Prize for Medicine for their role in penicillin development. After receiving their award, Fleming predicted that antibiotic resistance would soon become a major problem. Today, antibiotics have many uses. This includes use before surgeries to prevent infections, use to treat flesh wounds such as bite wounds or bullet wounds, and use to treat bacterial diseases. Before we delve into antimicrobial resistance, it is useful to define what it is. Antimicrobial resistance, often denoted as AMR, is infectious pathogens such as malaria or tuberculosis that develop resistance to antimicrobial drugs. Today, 700,000 people per year globally die due to antimicrobial resistance, and if left unchecked, this will reach 10 million per year globally in 2050. Antimicrobial resistance first began with the discovery of penicillinase, soon after the discovery of penicillin in the early 1940s. Penicillinase is a bacteria that inhibits the effects of penicillin. Starting in the 1950s and ending in the 1970s was the so-called golden age of antibiotics, where all current classes of antibiotics were discovered. In 1960, with the discovery of antibiotic-resistant plasmids, antimicrobial resistance began its increase in prevalence, culminating today. Today, there are various strains of bacteria that are resistant to antibiotic treatment, and these so-called superbugs are an increasing concern in hospitals around the world. Some causes of antimicrobial resistance include inappropriate prescription of antibiotics for viral infections such as pneumonia. Pneumonia can be caused by bacterial infection, viral infection, fungal infection, or parasitic infection, and it is often hard to see which is which without testing. Antibiotics are therefore given as a precautionary measure, just in case it is a bacterial infection. Antibiotics are also inappropriately used on farms, where they are added to animal feed for growth promotion and feed efficiency. Poor medicine quality, such as sublethal doses or substandard medication, can increase prevalence of AMR. Poverty can also cause people to buy medication from unlicensed distributors that offer cheaper prices than certified pharmacies but sell lower quality medicine, which also increases AMR. This graphic shows how AMR starts in the body. People who have bacterial infections are often treated with antibiotics. If they're administered correctly, the drugs will kill the vast majority of bacteria, both native bacteria and infectious bacteria. However, some of the infectious bacteria can be resistant to the treatment, and then will have optimum environment to rapidly spread. This causes the infection to evolve to become resistant to the original antibiotic treatment. However, there are several solutions to the issue of antimicrobial resistance. First among them are distribution solutions, which include country quality assurance systems and improved post-market surveillance. This will ensure that the drugs manufactured will be up to quality standards and that they will not fall into the hands of nefarious actors. Another avenue is in application solutions that include establishment of certified pharmacists in developing countries, ending antibiotic use for growth promotion in food animals, and implementing sequential regimens. Certified pharmacists would be able to help properly dispense and administer medication, which would help prevent improper use of antibiotics. The use of antibiotics in food animals can cause widespread AMR through their widespread and frequent usage. Sequential regimen use in hospitals will alternate between different drugs to preserve the efficacy of the treatment. In addition, international investment into antibiotics R&D will be very important. In recent years, antibiotics have actually become increasingly uneconomical for pharmaceutical companies to develop, and the number of antibiotics produced each year has decreased. Global bodies and governments, such as the UN or the WHO, should be incentivizing development of antibiotics. Companies should also be developing whole genome sequencing technology, which aids in development of new antibiotics and also helps in daily infection control. They can be useful in determining whether antimicrobial resistance is present. Another treatment method that is called antisense oligonucleotide treatment is still preliminary. This treatment uses PPMO peptides to target RNA genes for resistance in bacteria that resensitizes them to antibiotic treatment by inhibiting efflux pumps that reject antibiotics. During the pandemic, antibiotics have also played a role. Infections such as pneumonia or urinary tract infections can often accompany COVID infections, but they might not always be bacterial. 8% of COVID patients had bacterial infections, but 72% of them received antibiotics. This is most likely because antibiotics are used as a precautionary measure for pneumonia symptoms, which are often very similar to COVID symptoms. Since elective surgeries have been greatly restricted or all-out banned, antibiotic use has actually declined 40% since the start of the pandemic. In conclusion, there are several steps that the world must take to address the issue of antimicrobial resistance. First among these is significant investment from international coalitions into quality standards and drug sales/prescription regulations. This would ensure that the medication dispensed would be up to quality and doses would be proper. We would also need to greatly reduce antibiotic use for animal growth promotion, incentivize antibiotic development and antimicrobial resistance treatment developed by Big Pharma, and collect data on how antibiotics are regularly administered in our hospitals. As for a personal measure, you should take antibiotics as they are prescribed and complete the regimen even if your symptoms disappear. You also shouldn't save antibiotics for the future, nor should you take them for a viral infection. You also shouldn't share them with anyone else, even if your symptoms are the same. That will help avoid antibiotic resistance. Thank you for your time listening to my presentation. If you have any questions or comments, please email me at steven.wu.725@gmail.com on this slide. Thank you for your time.